Welcome to the WHO Africa Media Briefing. My name is Dr. Mary Stephen. First, some housekeeping. You can listen to the press briefing in either English or French. To do this, please go to the bottom right-hand corner of your screen, click on the globe icon, and select your most preferred language. Vincent, please.
Bonjour et bienvenue à cette conférence de presse de l'OMS Afrique. Vous pouvez choisir de suivre cette conférence en français en cliquant sur le globe en bas à droite, le globe interprétation, et en choisissant donc le français. Over to you, Dr. Mary.
Merci beaucoup, Vincent. And now joining us from Geneva is Dr. Matshidiso Moeti, the WHO Regional Director for Africa, who is currently on a mission in Geneva. Welcome, Dr. Moeti.
Good day, bonjour to all the journalists who are joining us today. As Mary said, I'm in Geneva, where I've come for a WHO management meeting with all our country representatives. This is our last press conference for 2022, and I'll look back at some of the health issues that have dominated the year, particularly COVID-19 and the Ebola outbreak in Uganda. I'm delighted to be joined by Dr. Jane Ruth Acheng Ochera, the Honorable Minister of Health of Uganda, and by Dr. Ahmadu Lamin Samate, the Honorable Minister of Health of the Gambia. A very warm welcome to you both, Honorable Ministers. As we head into the year-end holiday season, we see Africa has recorded a 4-week-long rise in new COVID-19 cases until the 20th of November. But the number of new cases dropped slightly in the past 2 weeks, breaking that upward trend. With a little over 12,300 new cases and 50 deaths, the numbers remain at their lowest since the start of the pandemic. Despite the recent uptick, there is hope that Africa will be spared the challenges of the previous 2 years when surging cases marred the holiday season for many. While the current efforts keep the pandemic within control, we are carefully monitoring its evolution. We must remain vigilant and be ready to adopt more stringent preventive measures if necessary. We're also seeing that the investments made in COVID-19 over the last 3 years are paying off, with the region better able to cope with the virus and its health emergency response system bolstered. At the onset of the pandemic, the average number of intensive care unit beds stood at 3 per 100,000 people, for example, below the WHO recommendation of a minimum of 5 per 100,000. With the support of WHO and partners, 70% of countries in the region have met the minimum standard. Medical oxygen production has also grown. We've supported 9 countries to set up and maintain oxygen production plants, increasing the region's output by 7.9 million liters a day, enough to treat 1,130 critically ill patients a day. This is 1/3 of the continent's needs, but other partners are also contributing to the efforts to address that gap. This strengthening of emergency care in health facilities benefits patients with a range of diseases beyond COVID-19, including asthma, chronic obstructive pulmonary diseases, and severe pneumonia. In addition, Africa has made huge steps to strengthen laboratory capacity, including conducting genomic sequencing. Around 105,000 sequences were produced in 2022, compared with 58,600 or so in 2021. This increased capacity has now been used to track other viruses such as monkeypox, Ebola, and cholera, and will be a key public health tool of the future. In recent months, a great deal of effort has been made by African countries on COVID-19 vaccination. I commend the efforts of our member states in carrying out mass vaccination campaigns and increasing their coverage through them. We acknowledge that there are gaps in vaccination, especially in reaching the most vulnerable groups. Still, we've seen an increase in the number of vaccinated health workers, older people, and people with underlying illnesses such as diabetes and cardiovascular diseases. there is a need to reach higher coverage in these most vulnerable groups, accompanied by integration with appropriate boosting. We'll continue to support countries to ensure that vaccines are always available to all eligible people. Local production of vaccines has emerged strongly as an important way forward. The mRNA hub in Cape Town, South Africa, for example, and its branches, which will share mRNA technology with manufacturers in African countries, is a critical platform. There is also the Afrigen platform that has developed the first novel vaccine produced on the continent. All this in addition to strengthened regulatory capacities, partnerships, and collective processes. The pandemic is not yet over. We must maintain our successes into the coming year and beyond. And as we move into 2023, it's time to bring COVID-19 out of emergency response mode and integrate it into routine healthcare. With the last confirmed case discharged on the 30th of November, 2022, Uganda has begun the countdown to the end of the Ebola outbreak in that country. Candidate vaccines against the Sudan Ebola virus arrived today in the country. This is a promising step towards possible protection against the virus, with African researchers taking a leading role. It showcases the power of scientific research on our continent. We've been pleased to support the training of healthcare workers and providing additional equipment, and we'll be pleased to hear about this from the Minister of Health. Our goal is to end the outbreak, but it is dynamic. We've seen that new cases can be confirmed in the last days of a countdown. We've seen that in other Ebola outbreaks as well. We must therefore not lower our guards, and we'll remain in active response mode. So we're supporting the country in conducting enhanced surveillance with strengthened active case searches in health facilities. We're also ensuring that all countries in the region are better prepared for emergencies. We conducted the region's largest public health emergency operations center simulation exercise this week. The training aims to step up awareness and preparedness, with 36 countries participating in the two-day exercise. Another crucial health concern for our region is malaria. As you know, Africa bears the heaviest burden of this disease. Today, we're releasing new data on malaria, showing that despite widespread disruptions of the COVID-19 pandemic, countries held back against further setbacks in malaria prevention, testing, and treatment services. Although malaria cases continued to rise between 2020 and 2021, the pace was slower than the increase recorded between 2019 and 2020. But even with the slowdown, efforts to reach the targets for reducing global malaria cases and mortality rates by at least 90% by 2030 face many challenges, especially on our continent. We're supporting countries to accelerate progress against malaria by reinforcing measures to curb anti-malarial drug resistance and stop the spread of the malaria vector. To make this a success, new tools and the funding to deploy them are urgently needed to help us defeat malaria. Thank you once again, dear colleagues, journalists, for joining us, and I'm looking forward to the conversation on these important health issues and in our region. And once more, a warm welcome to our two ministers that are joining us today.
Thank you very much, Dr. Moeti, for that elaborate summary on the journey so far since the beginning of 2022. And now to you, Honorable Dr. Jane Acheng. Please tell us about the progress and challenges in responding to the Ebola outbreak in Uganda. Welcome, Dr. Jane.
Thank you very much, Mary. And it is an honor for me to speak at this conference with colleagues from the African Union. Allow me to thank my sister, Dr. Moeti, and I see my WR seated next to her. I am still waiting for him to return home so we can continue doing our work together. It is a great opportunity for us to review the year as it has transpired, to account for our successes and where our challenges, identifying the gaps to address and aim for improvement. As you're all aware, on the 20th September 2022, the Ministry of Health in Uganda declared an outbreak of the Sudan Ebola virus. This followed identification of a positive case in a district called Mubende in central Uganda. It is now 83 days since that case was reported. Since then, 142 confirmed cases have been registered, with 56 deaths and 86 recoveries. The outbreak spread to 9 districts, 3 of which have completed 42 days follow-up. That includes Kagadi, Chegegwa, and Bunyangabu, all in central and western Uganda. We continue to monitor the situation in Kampala, Wakiso, Masaka, Jinja, Mubende, and Kasanda. However, we take note that nearly all these districts have completed 21 days except for Kasanda, which is 9 days today. I wish to thank all the responders and the health workers who have been working since the 20th of September to respond to this outbreak. I thank them for their sacrifice and commitment to the response. Among the cases, 19 were health workers, and unfortunately, 7 of them succumbed to the disease. Since the start of the response, our aim has been to rapidly contain the spread of the Ebola virus disease and to ensure that no case is exported out of Uganda. To this effect, the Ministry of Health, with support from the World Health Organization and other partners, deployed several strategies across all the response pillars to achieve this objective. We developed and implemented a response plan targeting 3 categories of the districts. The very high-risk districts that we are reporting confirmed cases, the high-risk districts that were 20 in number, neighboring the epicenters, and the moderate risk districts, which was the rest of the country. Though the outbreak evolved rapidly with strong leadership and coordination across the pillars, we have registered success. It is now 9 days since the last confirmed case was discharged from the Ebola treatment unit. Our efforts are focused on ensuring that we monitor and intensify surveillance for any new case that may pop up, because we are not yet out of the woods. A total of 4,661 contacts were listed for follow-up. To date, 4,615 have completed the 21 days follow-up. The country established capacity for isolation, and these were 6 Ebola treatment units, 3 in Mubende, 1 at Entebbe, and 2 in Mulago Hospital, with a total bed capacity of 389. We are scheduled to commission the 2nd treatment unit in Mulago Hospital tomorrow. Analysis of our data from the start of the response identified two common routes that were propagating transmission. This was household transmission and health facility transmission. This underscores the need to strengthen engagement of communities to break transmission at household level. We must invest more in communities since outbreaks start at the community level and end at the communities. In addition, allow me to emphasize the need for better coordination of all partners and activities, as well as the need to have readily available and accessible funds. In regards to health workers, we must invest in improvement of infection prevention and control at the facility level. Uganda is ready to adopt the IPC culture to save our health workers as well as the communities and our families. This Ebola outbreak occurred in the backdrop of the ongoing COVID-19 pandemic, as we all heard from the regional director. However, Uganda has also been registering other emergencies that are still ongoing in the country. We have cases of the Crimean Congo hemorrhagic fever. We have issues of food insecurity in the northeastern part of the country, and also a few cases of measles that are being reported. This underpins the need for the country to build sustainable and strong, resilient health systems to be able to withstand shocks or emergencies, and also to ensure that essential services that are highly needed continue without interruption. All in all, these outbreaks highlight the importance of a multi-sector approach in handling emergencies. Allow me to thank the World Health Organization. In a special way today, we received 1,200 doses of the Sabin Sudan Ebola vaccine. Our scientists are well prepared and ready to begin the vaccine trials. The setup for the vaccine trial has been ready, at least for over 2 weeks now. The health workers have been trained, and all the systems to start the trial is on course. We have also received information from WHO that sometime next week we will be receiving more vaccines. Uganda is ready to begin the vaccine trials, whether it is within the outbreak or post-outbreak. The scientists know how to handle this and adjust accordingly. I deeply appreciate in a special way all the partners, both multilateral and bilateral, who have ensured that Uganda is prepared for this intervention, as well as other researches that may be started in the near future. Lastly, allow me to appreciate the WHO colleagues for the support throughout this response, and even as we move into the next phase, to ensure that whatever has been put on the ground to build sustainable systems is protected. I thank you all for listening to me, for God and my country.
Thank you very much. Thank you very much, Dr. Jane Acheng, the Honorable Commissioner of Honorable Minister of Health in Uganda, and congratulations for the great work your team and partners have done on ground in responding to the Ebola outbreak. And now we are going to the Honorable Minister of Health from Gambia, Dr. Amadou Lamine. Gambia has been leading the continent's efforts in malaria response, and you have achieved some critical goals. Can you give us an update on some of those achievements and the lessons learned? Welcome, Dr. Lamine.
Thank you very much, Madam Mary, for inviting us to be part of this panel. I think it's a very important end-of-year panel. We extend our greetings to you, to Dr. Moeti, to other panelists, to my sister, Honorable Jane from Uganda, and all the distinguished journalists who are part and parcel of this process. We say good morning to you all. Since 2015, the Gambia has been one of the few African countries to have achieved the global technical strategy for malaria goal of having reduced malaria case incidence in the country by 40% through 2020. We have successfully reduced the prevalence of malaria parasite infestation in the general population from 4% in 2010 to 0.1% in 2017. The Malaria Indicator Survey of 2017 showed that usage of insecticide-treated nets in children and women was 62% and 69% respectively. This is a significant achievement, not just for the country, but also for our partners, to whom it is a testament that through sustained support and collaboration across all health partners in a given country, we can and we will achieve positive health outcomes for the citizenry. Malaria parasite prevalence among children aged 5 to 14 years decreased from 2.6% to 0.2% between 2014 and 2017, making it a reduction of 92%. But how did the Gambia come to achieve these goals? A combination of factors based on the strategies employed. One is the seasonal chemo prevention strategy, whereby children aged between 3 to 59 months in 3 regions have been given chemopreventive medications to protect them against development of malaria. Indoor residual spraying, this has been a big winner, whereby households, the walls of the homes of people are sprayed to ensure that the malaria vectors are discouraged from inhabiting those places, and in many cases, they are also killed. Now, this has been a big success in the rural communities. However, the acceptance in the urban areas has been pretty low. This is also coupled with the acquisition of 3 fogging machines that have been provided for the country by Global Fund and Rotary International. This enabled us to regularly spray the communities where we have water passages, where we have stagnant waters, and where we have bushes. This has also helped in our strategy in dealing with the malaria vectors. The use of insecticide impregnated bed nets has been a big winner. The fact that these are supplied to the communities free of charge after massive sensitization, this has been a big winner, and certainly we thank the partners, Global Fund and other partners who make that possible. The chemo prophylaxis also given to pregnant women has also been a big contributing factor to the reduction of malaria in the Gambia. Active case search and case management in the health facilities has also contributed immensely to our strategies in dealing with malaria. And this actually starts in the community by the use of the village health workers, who are part and parcel of our primary health care strategies. These individuals are given drugs after being trained to detect, diagnose malaria. And the RDT availability in the communities has made a big change, a big improvement, in the sense that the village health workers have the ability to detect malaria early enough to provide the drugs that the patients need. It should be emphasized that with all those gains, the COVID-19 pandemic certainly has had an impact on what has happened, what was happening, and what is still happening with regards to the cases of malaria in the Gambia. It should be noted that there has been a slight reversal in the achievements during the period of 2020, which we all know has been attributed to the COVID-19 disruptions of the strategies that we've been employing. The disruption of essential services due to the pandemic led to the rise in the number of confirmed malaria cases. We saw an increase from 2019 to 2020 with corresponding figures of 46.8 to 87.3 reported cases per 1,000 population at risk, according to the World Bank database. The number of malaria-related deaths also spiked in 2020, but fell again by 7% in 2021 after mitigating the disruptions caused by the COVID-19. These achievements wouldn't have been possible without the sustained partnership of all the entities that have come together, from the community level to the government level to all the multinational partners, all the civil society organizations who came together on a regular basis to develop the strategies. Of course, amongst these, the Global Fund stands tall. Out of the lot, the WHO and the Sahel Malaria Initiative and the President's Initiative on Malaria, just to name a few. The Gambia developed a national malaria strategic plan, which has been the roadmap for the Ministry of Health, with the goal of zero malaria deaths by 2025, and it is in the second year of implementation. This strategic plan faces funding challenges, though, we could hinder the progress up to date, particularly when it comes to cross-border malaria prevention strategies. At this juncture, it is important for us to emphasize the successes achieved by the cross-border collaboration between the Gambia and Senegal, which is actually bringing the two countries together, the experts of the two countries, to put together collective strategies in ensuring that we deal with the issue of malaria in a synchronous manner, whereby we have synchronous distribution of insecticide-treated bed nets. As we say, the malaria parasite doesn't recognize and doesn't know that there is a border between the Gambia and Senegal, and the Gambia being a small country with villages across the border in Senegal, we realize that if we do not act in a synchronous manner, even if we deal with all the cases and all the vectors of malaria in the Gambia, at night, the mosquitoes will fly from Senegal into the Gambia. So for this reason, we came together to have cross-border strategies, and we urge other countries to emulate this because it is yielding the desired results. Moving forward, the Gambia is heading towards elimination of malaria, and we believe this is technically and resource-wise possible, but though it is both technically and resource intensive. We are expeditiously working to develop capacity across the health system for effective malaria surveillance for initial elimination in selected health regions. The malaria certification map has shown that the malaria new infections are concentrating in the two most densely populated regions of the country, which happen to be the most urban of the whole country. And unfortunately, these are also the areas where indoor residual spraying is not as successful, probably because of the urbanization and the different mindset. However, with more health education and risk communication, we hope the behavior will change with more understanding of the impacts of malaria and the results, the positive results that may come out of the indoor residual spray. These are the two western regions close to the capital. And of course, as we all know, typically these are the areas where we also have overcrowding and also challenges with drainage systems. But with improved road networks, with improved sewage systems, with improved drainage systems, we hope all this will contribute to the elimination strategies of malaria. But at this juncture, we cannot overemphasize that malaria elimination typically goes with the general development of the country. If we do not have good road networks, we have potholes everywhere, certainly those will be breeding grounds for mosquitoes. Equally speaking, if the sewerage systems are not good, we equally expect mosquitoes to have breeding grounds. So the overall socioeconomic development of the country is important to ensure that we eliminate malaria. But that said, before I conclude, I would like to equally emphasize the participation of the communities, the ordinary people in the communities. The Gambia has been making very good use of the traditional communicators, which we call the Kanyalengs. They have access to the people in the villages and towns as well. They dramatize. So we have a lot of malaria songs related to malaria, songs related to controlling the vector, songs related to how people detect malaria, what the mother should do, how they look for symptoms and signs of malaria in their children, what they should do. And these have all contributed to building the capacity, the knowledge base of all individuals in the country. And the community participation really has been a big success in our efforts towards the elimination of malaria. Thank you very much for your kind attention. Thank you. Yeah.
Thank you very much, Honorable Dr. Lamin, the Minister of Health for the Gambia. Congratulations for all the achievements in malaria control in the Gambia. And yes, I agree with you. The community participation is important in disease control and outbreak response, as we have rightly heard from Honorable Dr. Jane as well. So right now, it's to you, the journalists. We have heard from all the panelists. It's your time to ask your questions. To do this, please use the Q&A function on the Zoom platform. Tell us your name, the name of the media organization you represent. And if you would like to go live, kindly indicate in the Zoom platform that you would like to go live. On hand, we have additional experts that will help in answering your questions. In the room in Geneva with Dr. Moeti, we have Dr. Jonas Tegeng, the WHO representative for Uganda. And we also have Dr. Desta Trune, the WHO representative for the Gambia. And virtually, we have additional experts, Dr. Tiano Balde, the COVID-19 incident manager at the regional office, Dr. Miriam Nanyunja, the senior risk management expert at the WHO regional office for Africa, the hub from Nairobi. And lastly, we have Dr. Dorothy Achu, the team lead for vector-borne diseases. So right now, I understand that Gabriel from Wall Street Journal is ready to ask question live. Over to you, Gabriel.
Thank you so much. I actually have several questions. My first question is for Dr. Moetu and the two ministers. As we speak, the Gavi board is discussing plans to largely shut down the COVAX program and instead sort of integrate COVID-19 vaccinations into the sort of broader routine vaccination efforts. Do you think that this is the right strategy at this point in the pandemic, or do you think that actually, given where vaccination rates stand specifically in Africa, in fact, there should be a redoubling down on efforts to get shots into arms? And then a follow-up on that, given the sort of reversal in some of the progress on malaria and the plans to roll out globally or more broadly this malaria vaccine, are you seeing similar global efforts as we saw eventually with COVAX on the malaria vaccine? And do you think something similar is needed to get malaria vaccines to more people? And then a final question to Dr. Acheng. Can you explain in more detail how the vaccine trial will work with potentially no active cases in the country anymore? Thank you.
Thank you, Gabriel. Dr. Moeti, let's start with you.
Okay, thank you very much for those questions. I think, first of all, the question on integration or not of the COVID-19 vaccination and the discussion that's going on in the Gavi board. What I understand is that what is being discussed currently is the timeline that's likely to see COVAX continuing to provide support to countries and then sunsetting or transitioning out at the end of the next year, at the end of 2023, meaning the beginning of 2024. We're already seeing, in fact, quite a few efforts in countries with lessons being learned about how to sustain and continue to improve the coverage with COVID-19 vaccination, while at the same time integrating in various ways into regular services. And I think in this case, there are many lessons being learned. As far as we are concerned, it's very important, it's very urgent now to make sure that the most vulnerable groups that I mentioned and healthcare workers who are also exposed through their work are vaccinated in ways that make sure that these people are protected from getting severe illness and dying. As we know, this is elderly people, people over the age of 50 in some countries, people living with HIV, people who have certain conditions like diabetes, obesity, cardiovascular diseases. These, in our view, are the groups in which we need to, in this window that still exists, really push accelerating coverage, increasing the proportion of people that are covered and reaching the highest level of coverage possible, while also, of course, making sure that those of them who took their first series of vaccines early also are boosted, so to sustain the level of immunity, particularly protect them against severe illness. And then I think it's very important and appropriate as well to integrate in ways that, again, ensure that the most vulnerable people are reached into regular health services, so into primary healthcare services, into health services where we expect to find many elderly people and people with chronic diseases being managed. And I think that this effort as well can be combined with community-based approaches. We know, for example, that the HIV community sustained some of their own services during the lockdowns by expanding the reach of the health system and providing community-based services. So I think it's a very feasible approach to integrate COVID-19 vaccination for this community where these services are existing. So we think we will look for the decision of Gavi, but we think that it's important to make sure that the most vulnerable people are covered to the degree that's possible. And we think that the timeline that's proposed makes this feasible, in fact. So I think it is quite possible to do that.
Thank you, Dr. Moeti. And to you, Honorable Dr. Acheng.
Thank you very much, and allow me to appreciate the question about the vaccine trial in Uganda, when currently we are not seeing any cases of Ebola. First of all, allow me to state here that the most important goal of any response is to ensure that we protect the population and contain the outbreak as quickly as possible. But allow me also to emphasize the importance of research and generating scientific evidence, especially knowing that it is not the last time that such an outbreak will occur, and we want to be able in future to be ready for whatever comes. And so vaccine trials and therapeutic trials are extremely useful and must be undertaken. Today we are only 9 days countdown. That does not mean that there is no more Ebola. Intense surveillance is still ongoing in nearly all the districts of Uganda, but more so in the districts where we have had cases. We have not closed our Ebola treatment units. They are all open because we don't know what will happen moving forward. In any case, we are moving towards a festive season, but not only that, the restrictions that were put at the epicenter to control movements in and out of the epicenter will be lifted. And so Uganda needs to remain on high alert. It is true that the trial was designed for contacts to cases, and the trial is ready to begin. We still have many suspect cases in isolation under follow-up, not as many as people would think, but we still have them there. In the event that after 42 days, there are no more cases, and the World Health Organization in its wisdom thinks Uganda should declare no more cases, then the scientists will adjust accordingly. Because I am aware that trials can be done even before an epidemic, during an epidemic, and after an epidemic. So we leave that to the scientists to give us the wisdom that needs to be undertaken. But again, I emphasize the importance of these trials and the need to have readily available tools for response in the event of future epidemics. I thank you.
Thank you very much, Honorable Dr. Acheng. Dr. Jonas, do you want to comment on the Uganda outbreak?
Thank you, Mary. I think the minister has cleared it, that we are still 33 days more to go before we declare we are totally out of this outbreak. So we should get ready, and the fact that this tool is there, if we need to respond to do the trial, is important. But let's not forget that also our emphasis will not focus on the trial. Our emphasis would focus on making sure that we do not have cases. But if the cases are there, that we have this tool to test. Over.
Thank you, Dr. Jonas. I'm coming back to you, Honorable Dr. Lamin, back on the Gabriel's question. the lessons, if applying the lessons from the malaria to COVID?
Yeah, thank you very much. First of all, in relation to the COVID-19 vaccine and the proposed Gavi strategies, we first of all thank the COVAX facility, because without these initiatives, it could have been very difficult for many of our countries to get the vaccines when we needed them. And we thank all the partners. Now, with the change in strategy, with the talk about the integration and so on, we think it's a good idea. However, we were able to make the achievements that we did because of the campaign strategies, because of the aggressive nature of sensitization, and so on and so forth. And even with that, many of our African countries have quite a lot of challenges with regards to vaccine uptake. The Gambia fully vaccinated percentage stands at 18.2%, which is still very low. Now, that being the case, if we only integrate and we abolish the campaign modes and then all the further aggressive strategies, the sensitization, I don't think the uptake will increase much. But when you integrate into what system? For the under fives, their vaccination strategies are very successful because there are already systems in place. Children under 5 go routinely to the health facilities whereby they get all their vaccines. Those are routine vaccines. Now we integrate COVID-19 vaccination into the health facilities. And the majority of those who need these vaccines are actually at home. They only go to the hospital once in a while. So how are they going to get these vaccines administered to them in the facilities? So the best probably, or one suggestion probably, could be to integrate it into the primary healthcare strategies. Primary healthcare, but that also means that each village must have a primary healthcare unit. In the Gambia, not all the villages have primary healthcare units. We want to expand. We are on the expansion of primary healthcare services to cover the entire population, each village. But if we have a primary healthcare unit in each village, we have a village health worker. That way, those ones could be given vaccines for those villages, and you see the entire population could be encouraged to get vaccinated, and the vaccines will be available with these village healthcare workers to administer these vaccines to the individuals. So without this, I don't think the integration will give us the desired results of having increased coverage with regards to COVID-19 vaccination. So I think we need to look at the integration strategies as well. With regards to malaria and the malaria vaccine, we keep on saying this is long overdue, but we are thankful that we are now, seeing light at the end of the tunnel, that malaria vaccine is becoming available, because we've been saying the malaria endemic regions that we wish this were as fast as the COVID-19 vaccine development. It took decades for us to get here. Nonetheless, we are grateful, we are thankful that it's available. And for countries like ours, probably it will help us in our strategy to eliminate malaria. And for other countries also, it will help them in their efforts to reduce the malaria burden and the malaria deaths. Yes, the strategies employed in the COVID-19 vaccination campaign, which probably has not been seen before in the recent past, could certainly be beneficial in us rolling out the malaria vaccines. So we hope the COVAX-like structure is going to be available to help the countries that are affected by malaria to get access to the vaccines, and also for the rollout in the communities. So we are waiting for meetings to be initiated, to be coordinated by WHO and other partners, so that we can have the malaria vaccines made available to the population. Thank you.
Thank you very much, Honorable Dr. Lamin. And this next question is coming to you, Dr. Moeti. The question is from Columbus, from Voice of America. Looking at 2023, what should Africa do to avoid outbreaks or limit its impact on the continent?
Okay, thank you very much. I think if we reflect on the last couple of years and the response to the COVID-19 pandemic, we can see that we have learned a lot. We've learned a huge amount that is available now to be taken forward into the future as far as reinforcing Africa's preparedness for disease outbreaks and capacity to respond and close them down early. Several things. First of all, I think we've seen that the realization that health is a threat to economic development. It's not only a threat to individuals' health, to families' health, but also a disease outbreaks can have a very profound impact on health, on the economy of a country. One of the lessons learned then is the importance of investing in health, investing in public health in countries, and coming together as a global community and establishing platforms and mechanisms that make sure that we pool our resources to prevent, expect, and anticipate, and then react quickly and build the capacities on health. So I'm very happy that some global conversations are going on, including on investment immediately starting in reinforcing the public health capacities in countries to be ready for the next pandemic. So I'm expecting that this is going to roll out. We in Africa, as part of the discussions on the establishment of a global financing facility for pandemic preparedness, have already identified a couple of countries that will be our so-called pilot countries to benefit and really to fill the gaps in capacity of what we call international health regulations to be readier for the next pandemic. We're also recommending strongly that this be linked to work on primary health care and health system strengthening so that the next time there is a severe epidemic, we are readier to sustain making sure that we provide essential health care to people. We've learned a lot as far as that is concerned. And I think we know now what we need to do to be able to make sure that our systems are resilient to the impact of a shock like an outbreak. Work is already going on in our countries, and WHO, we have a program in which we're already working with countries to reinforce their capacities in several ways. We're helping our member states to train their core teams in the countries, multidisciplinary teams, so some community health workers, some nurses, some doctors, some data specialists to be the first group to start the response to a pandemic. We've started this in a number of countries. I think we are in 18 countries now which have started to train these core teams, their first responders. We're also looking to train some what we call elite responders, so experts with the highest level of expertise so that they can also be part of the response. We've seen a lot of work to strengthen public health institutions and emergency operations centers in African countries so that, again, we have an approach to coordinate and lead the response in our countries. One of the most exciting outcomes of the struggle with equity or inequity in accessing key tools in African countries is that we have a number of countries that have already started with the support of partners at the international level to develop capacity to produce locally some of the tools, particularly vaccines. We expect this to go to other tools as well. So what we are expecting going into the future is that, and we will have our own African researchers involved in the discovery of tools in clinical research to discover tools. So for example, the work that's going on with this Ebola vaccine that we've been talking about is part of that work to develop our own capacities, carry out the research in Africa, and the tools will be developed here. So I think that whatever happens in the future, the next pandemic will find the world and will find Africa much readier, both in terms of political awareness. We hope very much increased investment in health by the national governments, by the international community as well, engagement in the discovery of tools, building the capacities of our systems, and very importantly, I will say, making sure that we engage our communities in an ongoing way to enable them to play their part in the next response to a pandemic and also in health development more generally. So we've learned, I would say, some important lessons. We've formed some important partnerships that are going to take us forward into the future. African countries are establishing some very important African institutions to take the lead and to work in the area of preparedness and also in primary healthcare. I'm very optimistic that the future, however difficult the past couple of years have been, will find us in a much better situation in terms of our strategies, our investments, and our capacities to confront public health threats in the future.
Moeti, and this next question is coming to the Honorable Minister of Health for Uganda, Dr. Acheng. This is from Flavia Nasaka from Uganda Radio Network. 83 days since the first case of Ebola was confirmed, and there has not been a report about the origin of this current outbreak. Was this a human transmission or an animal transmission?
Thank you very much for the question. Yes, indeed, it is 83 days, but it is 83 days of serious work. We, the Ugandan scientists and partners, have been at the epicenter, and several samples have been taken from bats and monkeys that are being analyzed. So we are not yet able at this point in time to clearly state what the origin of the outbreak is. However, it is also not the first time that Uganda is having an Ebola outbreak. This is our 7th outbreak, and we have been following up this issue. We do hope that in the near future, we shall have a concrete answer to give to the population. But what we know is that such viruses are harbored in the bats or in the primates. So we are yet to answer the question, because the area where the current outbreak started has a number of caves that harbors these animals. So my request is that we remain patient as the investigation goes on. Thank you.
Thank you very much, Honorable Dr. Acheng. And this next question is coming to you, Dr. Tiano Baude. The question is from Daniel Chege from the Standard Media Group from Kenya. With the COVID pandemic's impacts reducing and cases diminishing, countries have relaxed the WHO guidelines, which led to other variants and other dangers. What are the ministers doing to ensure everyone continues to adhere to the guidance? So, Dr. Baude, start with the technical bit, and then we go back to the Minister of the Gambia to talk about what the countries are doing.
Thank you very much. I think that the different panelists have mentioned really the importance of continuing engaging the different communities really in the response to the pandemic here. So I think that's something which is very key. Despite the fact that we are really seeing a few number of cases and deaths in the African region here, and especially at this moment where we are at the eve of the festive season, it's really important that we continue explaining the situation, continue explaining the risk that we are facing in the region here. I mean, in terms of the consequences of the COVID-19. So it's I think the main point here is really to try to explain, and we are recently in some of the countries working with communities, trying to understand really the questions and, for adhering to the public health and social measures, but most importantly to the vaccination also. And we are seeing, when we really take all of the different efforts for explaining, the factors, explaining the current situation, people used to adhere, to and accept to get the vaccine and accept also to protect themselves, especially when they are being, in a kind of at-risk situation, notably in some kind of health facilities or people who are having currently, some comorbidities. So this is something which is key. But overall, I think it's important to mention that also we are really living in one world. So what might happen, the region may also affect, in the other regions, especially here in Africa. And we know the risk of having new variants. So it's really important that really the population and the communities and also the national health authorities really take all of the appropriate measures for continuing, being vigilant at this moment. Thank you, and back to you, Mary.
Very much, Dr. Tiano Balde, and to you, Honorable Minister of Health for the Gambia. Please, from the country perspective, what are the countries doing?
Yeah, thank you very much. We have similar challenges, across all the countries, most of the countries in our sub-region. Now, in the Gambia, we've had our challenges with uptake with regards to vaccinations. But however, I think we need to have a relook at our communication strategies. It looks like the strategies currently being employed are saturated. And the human mind is such that when things are saturated, you need to devise newer ways of getting acceptance. We have had a series of meetings. We have spoken to colleagues from other countries. What did they do that made the uptake go up? Whether it is ensuring that people are motivated by getting vaccinated, or ensuring that people, before they get certain services, they get vaccinated. Before they enter the ferry, they get vaccinated, or they enter public places, and so on and so forth. So these strategies need to be strengthened. But of course, you would have also experienced that probably. But what we saw in the Gambia is, unfortunately, the vaccination rate increased when the number of cases increased, and then when mortalities increased. So people, that was usually the time that people saw the need to get vaccinated. When things get better, they even think COVID is no longer a problem. And we are all battling to remind people that COVID-19 is still a challenge. I'm sure the day I dropped the mask in public in the Gambia, they say COVID is finished, because probably I'm one of the very few people who put on the mask, and the health team, the WHO, and our Minister of Health people. So we need to send reminders, but we also need to modify our risk communication strategies, because we've been saying the same things over and over, and it is not increasing the output. But I think countries also need to bring forward steps that will ensure compliance with the vaccination strategies. Nonetheless, hand washing, use of sanitizers, and so on, some people have gotten used to them as part of their daily routine, but the emphasis on these aspects is also dwindling, and we need to be reminded that COVID is still here. I think these are some of the things we are doing. At another level, our team is actually meeting to see what we can advise cabinet and, if necessary, parliament with regards to ensuring that people get vaccinated. But on the other side, to strengthen our preparedness for any resurgence of COVID-19 or any other pandemic, we're still doing the health system strengthening, building new health facilities, training more and more people, buying more and more equipment with the partners together. We are having construction works going on with our National Emergency Treatment Center, which is sponsored by the World Bank and part contribution from the government of the Gambia. That's a big one. That's a 104-bed emergency center with 20 ICU beds, we didn't have close to that. So that should be completed sometime in August this coming year. So by that time, our preparedness with regards to dealing with health emergencies will be better. So we have used the resources from to strengthen our health system. We bought in ambulances, ventilators, monitors, and so on. Where we think the gap still is, and I'm sure Dr. Moeti and the entire team will remember, I always hammer on this point, is the training of more intensive care specialists. That is a big challenge. If we have a resurgence of COVID-19 again, we still might have challenges in having intensive care doctors and nurses in even the intensive care facility that is being built. So I think partners and the support of the partners and the countries, we need to make it possible to train more intensivists throughout the world. The rate is gotten better, but some of us do not still have intensive care physicians and nurses to help us deal with any future pandemic. Thank you very much.
Thank you very much, Honorable Dr. Lamin. So because of time now, we are going to go into the final messages by our panelists. Apologies for some of those questions that we have not been able to take, but I would like our panelists to take into account this question as they wrap up. So the first question is, how will you describe your expectation for 2023? And additional question to Dr. Moeti and Honorable Dr. Acheng is, overall, how can you view the entire Ebola fight in Uganda? So this was from UBC Radio, Sarah, Uganda. So let's start with you, Honorable Dr. Lamin, your final thoughts and expectation for 2023.
Thank you very much, Dr. Mary. Well, Mary, just a reminder, my name is Ahmadu. Lamin is my father's name, actually. So, Doctor, yeah, thank you. Now, with the expectation for 2023, I think we are optimistic. 2019, 2020, 2021 have been very, very difficult years for many health systems, many countries. The Gambia, of course, is one of those. It's been very difficult, and we have our own country challenges as well as the global challenges. We started the health system strengthening. I think COVID-19, the COVID-19 pandemic has been an eye-opener for all of us to know where the gaps have been. We knew there were gaps. We didn't know the gaps were this great. But now that we know the gaps are there, we need to work together to fill in those gaps. But the bottom line is to strengthen the health sector across the world. It might be over-ambitious if we say we try to standardize. Let's have support systems whereby countries with challenges are brought on board, to a certain level, so that we all have strong health systems. National governments have roles to play, but the international community has important roles to play as well. We've seen in the COVID-19 pandemic that one problem in one part of the world is a problem for the entire world. So strengthening health systems across the world is in everyone's interest. So we should support health systems in low-income countries. With increasing globalization, if the low-income countries are left behind and epidemics come up, pandemics come up, no one is safe. So this is my last message. We need to work together collaboratively to support each other to have a robust world health system. Thank you.
Thank you very much, Honorable Dr. Amadou. And now let's go to Honorable Dr. Jane Acheng for your final thoughts and reflections on those questions I read earlier.
Thank you very much, Mary. First of all, allow me to start by appreciating the press and also my co-panelists my brother from the Gambia, and my sister, Dr. Moeti, for this great opportunity. Indeed, the last 3 years have been very difficult. And I would say more so for Uganda, because as we are still battling one pandemic, another epidemic comes on board. So we are looking forward to a better 2023. The pandemic has exposed many gaps and challenges that need to be addressed, not only in terms of regulations, but also in terms of building resilient systems across the world. There is therefore a lot of work that needs to be done by both multilateral and bilateral partners. And I am sure that WHO is up to the job to ensure that they support countries to put in place systems that will not only be able to respond to outbreaks, but also ensure continuity of essential services. I want to appreciate the setup of the pandemic financing facility, and it is my hope that this facility will be easily accessible and readily available, more so for the developing countries to access and begin to build the systems that they need to have in place. There are many lessons that we have learned over time. The very big Ebola outbreak in West Africa, and as well as the COVID-19 pandemic. The lessons are good because every outbreak must leave us stronger than before. And it is my hope that all these lessons will be consolidated and used to make the world a much better place, but also to make systems for response much better. It is my hope that never again will we see high mortalities due to outbreaks, because we'll have the tools in terms of vaccines, in terms of therapeutics, but also in terms of systems to respond. In regards to the Ebola response in Uganda, all of you are aware that Uganda has had opportunity to respond to several outbreaks. So it is not news, or it is not a surprise that Uganda rose up to the challenge together with the partners. And Uganda will continue to strengthen its system. For us, it is a great opportunity because what has been set up can be used as training facilities, not only for Uganda, but for the region. And therefore, I continue to appeal to the World Health Organization to use the facilities that we have set up for Ebola to expand the knowledge base and training to make Africa a much stronger continent to respond to emerging and re-emerging threats. Thank you once again for the opportunity, and God bless.
Jane Acheng. And now finally to you, Dr. Moeti.
Yes, thank you very much, Mary. And first, I'd like to sincerely thank my fellow panelists, my brother, the Minister of the Gambia, and my sister, the Minister of Uganda, with whom I was a few weeks ago visiting to follow up on the Ebola outbreak there. I think my own perspective going forward into the next year is really one of huge optimism. Despite the big challenges that I know exist, especially from the perspective of the economic impact of the pandemic on our countries, while we're at the same time encouraging even better investment in health, because we've understood the threat that it represents to all sorts of aspects of life, including economies, and how it particularly, problems like an outbreak can make the lives of the most vulnerable people in our societies and countries even more at risk. I think we've seen many things happen which we are determined to carry forward in WHO. For example, if I can cite a few, building on what the ministers have already said, we've seen partnership with the private sector in African countries emerge very strongly. So they have worked on playing their part, not only finally when we were forced to acknowledge we can't get the tools, we saw innovation in producing infection prevention and control materials in African countries. So we know that we have a private sector that is available, as well as a private sector that can expand the capacity of our healthcare systems to provide care, to respond to a pandemic that happened in many countries. We know, of course, that at the lower scale in terms of investment, the private sector can also be a risk. I think we saw in Uganda that some of the private facilities where the transmission of the Ebola outbreak went means that in our response, in our building of capacities, we need to take into account the private sector in its different manifestations, including small private clinics that can be places where people acquire communicable diseases and where pandemic spreads. So that partnership with the private sector holds out a lot of promise, including in the area of discovering new tools. Secondly, we saw huge capacity for innovation. Young African scientists innovated, produced different tools that have supported the response to the pandemic, including especially leveraging the capacity of digital technology. So in my view, these are the real possibilities that we can take forward as we build the capacity to respond in our region. We've seen that we have African scientists who, if they're mobilized, if we partner adequately and effectively with international funders, can be part of our national innovation ecosystems to develop new tools. And we're seeing in the local production of vaccines, some of the work that's emerging from the pandemic there, that we can do some of this on the African continent. And as I said, we have started in WHO to already expand some of the work we're doing, working with the labs that exist for different diseases, including those that were invested in for COVID-19, to improve our genomic sequencing capacity, which is a tool that we can use for many other diseases. We've seen the emergence of a lot of work on data, and we know that data is quite central to everything that we do in health development. If we canalize and organize all of that capacity together, we can deal with many, many diseases. And then finally, I think partnership has emerged as a very important part of the work that we are doing. I've heard both ministers repeatedly say WHO and other partners need to continue to invest and work in different ways to support their efforts. And I'd just like to conclude by saying that in WHO, we are absolutely committed to playing our role as the organization that has the responsibility in the world to build the systems for pandemic preparedness and response, but very much to work with other partners, to work with partners in other sectors, because we've, looking at the extreme weather events, the minister of Uganda was citing the eastern part of Uganda where there has been a drought. We understand that climate change is a big driver of vulnerability to diseases, so we're prepared to play our part there as well. So to conclude, we've learned a lot. It's been a very challenging couple of years. We are ending the year, I believe, on a high note. We have started, we are ending the year seeing that even as we are going into the festive season, we are anticipating with the level of vaccination, it's not where we'd like it to be, but if we continue to seek out and prioritize those who are most vulnerable and the capacities that have been built for care, I'm not expecting to see the number of deaths that we've seen in the last couple of years during the season. So I'm hopeful, I'm optimistic, I'm committed with my WHO colleagues throughout Africa to work with our member states, to work with our partners. The next pandemic will not find us at the level of vulnerability that we were, and we are hoping that the international community will accompany our member states with financing to improve our health systems and our capacity to be resilient. Thank you all very much, and a big thank you to our colleagues, the journalists. Let's continue to engage our communities together in terms of disseminating information.
Thank you very much, Dr. Moeti. And we have come to the end of the press conference for today. and the press conference for the year 2022. So a very big thank you to all our panelists, to you, Dr. Moeti, to the two honorable ministers of health from Uganda and the Gambia, to all the journalists, to all the team, and from all of us at WHO Afro, I would like to wish you a Merry Christmas and Happy New Year in advance. See you in 2023.